Hello, everybody. Again, it's Scott Wellick, the Associate Program Director for the NICU Fellowship here at Children's Wisconsin, the Medical College of Wisconsin. This morning, I have the opportunity to speak with another one of our wonderful faculty members, Dr. Susan Cohen, Associate Professor of Pediatrics. Susan, how are you doing today?
I'm so good, thanks.
Thanks for joining us. So, we all know about the pandemic. Unfortunately, all of our fellow candidates won't be able to come here, see the place in person, and meet all of us in person. So I wanted to take the opportunity and show off all of our wonderful faculty to them. So just to start off with, how long have you been here at Children's?
Well, I came in 2011, so just over 9 years, straight out of fellowship. I was on the East Coast training, and we came to Wisconsin primarily because of jobs. My husband and I are both physicians, so we found a really good match for both of us here.
Excellent. Now you have, over the last 9 years, carved out a really neat academic career as, mentoring fellows and all the cool clinical research stuff you've done. Could you share a little bit about the stuff you're working on now and not only for the research, but also how you've done a great job mentoring some of our fellows. So.
Yeah, so I started off as a basic science researcher. My focus was on brain development, particularly focused on the blood-brain barrier. That was influenced a lot by my fellowship experiences, and that gave me an opportunity to sort of continue in that path. But as I went further into my basic science research, I just found myself wanting to be more translational and finding an opportunity to take what I learned at the bench to the bedside. We are MDs, and I think that that's an important fact that we like patients. And I was given an opportunity to develop the neonatal neurocritical care program here. So partnering with my colleagues and other parts of our enterprise, including pediatric neurology, neuroradiology, and neurosurgery, we've really developed this multidisciplinary group, and it gives me a new sort of avenue for research where I'm entering clinical research. And my mentorship with fellows has been critical for the success. Specifically, we have an incoming fellow who worked with us when she was a resident. We have current fellows working with us, and they're harvesting a lot of the really ripe data that we are collecting within our unit. And it's giving us a sort of position to be able to distinguish us amongst other NICUs who have neurocritical care programs.
Excellent. Well, I say I'll just pause for a second. I hear you're right by the ambulance area, but that's all right. So now, how does the neurocritical care, patient care stuff, how does that help with fellow education? What kind of things are you guys doing to help the fellows learn about this really unique and I think up and coming area of neonatology?
Well, it's given us an opportunity to work closely with our neuroradiology group and having them teach our fellows how to read head ultrasounds and MRIs and providing sort of insights of the correlation to the clinical context. I think it's been mutually beneficial too, because the neuroradiologists really learn a lot from us because they're not privy to the patient's condition. And they provide us with insights for things that maybe go well beyond just the written report. And so that was wonderful to see how fellows and the neuroradiologists sort of combine their experiences to learn from one another. We've included fellows in a lot of our QI and our general guideline development. We started off with looking at how we document HIE, and the fellows have been instrumental for the success of the QI component of that project, implementing EPIC, smart phrases, getting people on board with doing full neurologic exams, being critical about the decision-making on HIE. And I think that's important because as you transition into independence, as you leave fellowship, that's probably one of the hardest things to do, to feel confident that in the real time, you can do an assessment and make a decision on whether or not you use therapeutic hypothermia. And I think these tools using technology and also expertise of our group, I think fellows leave feeling much more confident. guidelines that are more state of the art, such as post-hemorrhagic hydrocephalus, utilizing tools on neuroradiology to measure and to document size of the ventricular enlargement helps fellows also gain that sort of tool to communicate with other people about their concerns for a patient. And I think that has been valuable because the fellows have really helped us implement these guidelines in real time, and has been much of the success that we've seen, like I think is directly related to their involvement.
Definitely, definitely. Your thoughts, now you came from some units on the East Coast, but your thoughts about our unit here. What strengths from a clinical standpoint would you get as a fellow here at Children's?
Oh, I was most impressed by the diversity of patient complexity. I think there's a sort of higher level of acuity, and also multiple disciplines that are required to care for these patients. I didn't really appreciate how much having all of these different resources within a children's hospital enhances the care that we provide. And I don't know, I just feel like the residents here and the fellows here get such a exposure to a really high acuity, high complexity patients. And I think we benefit from being the biggest children's hospital, the only children's hospital in the state of Wisconsin. So our reach is so great. The fact that they are participating in transport, going on these sort of very, very complex transports throughout the state of Wisconsin. I'm a little envious that they get to go on airplanes and helicopters and stuff. I think that really kind of gives a certain sense of credence to their role because they are the front line of our hospital.
Excellent. Now you guys have been living here, you said 9 years. What's something you guys like about the city of Milwaukee?
Oh, I came here as a young family. My kids were little. They were 3 and 1 when I arrived. And so what I liked about it is the neighborhood feel of most parts of the surrounding area around the hospital. I first lived in Wauwatosa, and I loved how walkable and how accessible it was, especially for small families. We ended up moving to Brookfield, which I guess it was really for our dogs. We needed more space. We moved to a suburb of Milwaukee that provides another wonderful neighborhood kind of feel, community that is very family centric. That being said, what I like about this city is that there's also that downtown vibe as well. It reminds me of a lot of the place of where I trained in Providence, Rhode Island, where it was kind of a big, small city, where you can go downtown and get that downtown feel, but then you could easily get there within 15 minutes to places where you really would want to live.
Excellent. All right, I know you have a million things going on, Susan. I don't want to hold you up, but one of the things I need to do, asking everybody just so they can get to know us as people, some interesting or fun fact about yourself.
I guess I went to high school in Japan. I lived in Meguro-ku, which is a little province of Tokyo. And I was age 13 riding the train and subways in Tokyo. And I can say a few words now in Spanish, or in Japanese, I mean, because I don't have the opportunity to use it all that often, but watashi wa Susan desu, dozo yoroshiku.
Excellent, Susan. I'm not quite sure what you said. I'm going to assume it's nice though. Person. All right. Thank you, Dr. Susan Cohen. Thank you everybody for listening. If you've got more information or need more information, questions, you can check out Susan's got a lot of stuff on our website, the Children's NICU website. Thanks everybody for listening. Take care and stay safe.
Thanks.